Hi, good afternoon everyone. My name is Ashmita Adhikari and I'm here for my INC2 Oscar video. My strain ID is u3210931. And after reading the case study of Roy Champion, I made him the 3 priorities of care that is very important for him. So the first priority of care will be the pain management. At first I will do the pain management using the PQRST techniques. As he complained that his pain is at 4 out of 10, so I will check his medication chart, check for his pain medication regular when he had before, when he's due. If not, PRN medication is charted as pain is 4. Provide him anesthesia like PRN might help him with his pain for now. If there is no PRN, then I will notify to the doctor, and while administering medication I will check for the 7 medication that are right for medication, the checking whether the medication is right or not right for patient. So checking whether this is for the right patient by checking their arm badge, or even asking the patients to tell them their name or birth date, and checking for the right for dose, like what amount of dose we need to give it to the patient, right for route, like either we are giving from oral or either we are giving by IV. And next is right for reason, like why we are giving this, like explain to the patient like why we are giving this and why it is important for you to take it. And right for documentation, like after giving the medication we need to chart it properly so we can see what we have given to him. After the 7 steps are done, we need to also check the 3 check for the medication. That is, the first one is again check the medication proper, whether it is correct or not. Check the patient's name, frequency, time, and also the main thing is whether it's expiring or not. Like we have to check the expiry date as well. After we are done, we need to even explain the patient, like this as example, we are giving you a Panadol for this, are you okay with this? And if he's okay, we need to explain that why we are giving this is a Panadol for you, and this is for your pain relief, so it can help you to reduce your pain. And after explaining the patient, and when the medication is eaten by the patient, we have to assure him that we will be back after 30 minutes to see him whether the pain has decreased or not, and if not, we will go with the further investigation on that. But after 30 minutes we will come back again to see his situation. And after all this, I will be informing my team leader and also document in a proper way. So the second one, I noticed that on the observation I found his lips was very dry, his urine output was 30 ml, the urine color was very dark, and it was very smelly too. And I also found his BP was very low, with aura being very high. So I would encourage him to take more fluid. Once his body is hydrated, so then his BP can go up, and urine color will also be improved. So I will explain to the patient that he has been dehydrated, that's why he's feeling very dizzy and his BP is very low, and so he could increase his oral intake and help to balance his BP. So at the last, the third one is wound management. Since Roy went through the surgery, he got some surgical sites. To manage infection, I will check his wound site, check if there is any signs of infection, bleeding, ooze or exudate. Do check the skin if it's swollen or there is any redness occurring. If there is any wound, I would do wound culture. As his temperature was also high, RO was little bit high as well, so there is a high chances to get the sepsis. So we do need to monitor his vital and wound sign frequently. So on the part 2, there are some questions that I need to answer. So during my handover shift, I will be explaining my colleague about the patient current situation and what are the priorities of care we provided to him, like the pain management, wound management, and even encourage him to do the oral intake more. And also oral intake more. So I will be explaining to my colleague about his current situation, about his muse, BP and everything in a proper way, and also charted in a progress road. And it is also important for the patients to know like what care we are providing. So I will be explaining the Roy about the medication, about his own infection, like what we have to do it if there is anything like swollen or redness. If he can notice, he can inform us and everything like that. And even we have to, the main thing is, even we have to provide the consent with the patient, whether he's okay with the medication or not, whether he's working with the wound dressing or not. And after taking the consent, we will be doing all the procedure. Also we have to inform, also I need to inform the patient about his vital sign, like what is his muse number, like the VP was very low, so he need to hydrate himself to get in his proper situation, and engaging him to take care about himself as well as why we are doing the same thing to him. I think it is important for us to assess the patient care properly, because as a nurse we normally be with the patient like almost every time, so it's easy for us to examine the patient problem, identify it immediately, and to resolve the problem of the quality resolve the problem to improve the quality of people's life. And as while reading the case study, I found that he was living alone at his home. So maybe we can refer to the social worker or occupation therapy for his regular checkup until he doesn't get properly well. Thank you.